So let's start with the classification of hypertensive disorder of pregnancy. In this, we will talk about the association of hypertension and pregnancy. What are the classifications of hypertension in pregnancy? Also, the degrees of hypertension during the pregnancy. So first, hypertension and pregnancy. 1 in every 10 women have 1 or more episodes of hypertension prior to delivery. So it's common to develop hypertension during the pregnancy, 1 in 10. So it's very common. Incidence is high. 1 in 10 women have episodes of high blood pressure in pregnancy before delivery. Hypertension during the pregnancy, or if female is, or the pregnant women who never have hypertension before, no history of high blood pressure, they develop high blood pressure during the pregnancy, that type of hypertension is known as gestational hypertension. So hypertension of the pregnancy is known as gestational hypertension. Then pre-eclampsia. Once gestational hypertension is present, then it can lead to pre-eclampsia, and it's a serious condition. Pre-eclampsia can lead to eclampsia, also known as toxemia of pregnancy. So gestational hypertension can lead to pre-eclampsia. Is often accompanied by fetal growth restriction. If preeclampsia develop, it can lead to restriction of the intrauterine growth. So fetal growth restriction occurs. Chronic hypertension is another type of hypertension, usually that is present for a long time. These women have high blood pressures even before they become pregnant. So that's the chronic hypertension, and it's not associated with only pregnancy. So we have gestational hypertension leads to preeclampsia, and then another type is chronic hypertension that's already present. There is increased risk for mother and baby, preeclampsia and fetal growth restriction. So patients who have chronic history of high blood pressures, they should be managed regularly during the pregnancy because it can lead to preeclampsia and can cause fetal growth restriction. They should be treated by antihypertensive drugs which are not fetotoxic, or they cannot cause damage to the fetus. So only those types of drugs can be used, but they should be treated on regular basis. Classification of hypertension in pregnancy. Hypertension in pregnancy, we have non-proteinuric pregnancy-induced hypertension. So gestational diabetes, as I mentioned in the previous slide, gestational hypertension is the hypertension that can develop only during the pregnancy, and this can be non-proteinuric. There is no increase in the protein level in the urine. That is non-proteinuric type of hypertension. Then we have pre-eclampsia. There's also classification in the pregnancy, pre-eclampsia, and then chronic hypertension. So gestational hypertension that develops during the pregnancy is non-proteinuric type of hypertension. That's the differentiating point between preeclampsia and gestational hypertension, because in preeclampsia there is increase in the protein level and there is increase in the proteinuria. So that's the difference between the two types. And then we have chronic hypertension, as I mentioned previously. That's the hypertension that is present even before the pregnancy. So three types mainly. We have gestational non-proteinuric type, then we have pre-eclampsia, and then chronic hypertension. These are the three main types of hypertensions present. The non-proteinuric pregnancy-induced hypertension. Gestational hypertension. This arises for first time in second half of pregnancy in absence of proteinuria. So gestational hypertension is mainly occur in the second trimester of pregnancy, and there is no proteinuria in the absence of proteinuria. Not associated with adverse pregnancy outcome, usually not associated with any complications like intrauterine growth retardation or pre-eclampsia. So this is a little safer type of hypertension. Do not require any treatment. Up to 1/3 women progress to pre-eclampsia. So even gestational hypertension, initially it's non-proteinuric, can progress to pre-eclampsia and proteinuric type of hypertension. So up to 1/3, 1 out of 3, 1/3 of women progress to pre-eclampsia. Degrees of hypertension. If you see, we have 3 degrees. We have normal blood pressure, then we have low and high. So actually low and high are the two boundaries of the blood pressure, low and high, and then we have the normal range of blood pressure. Degree of hypertension, mild. Normal blood pressure reading is 120/80. There are two blood pressure readings. We have systolic blood pressure, which is the upper reading, and then we have lower blood pressure or diastolic blood pressure. Systolic or the upper blood pressure is when the heart is contracting and pushing the blood into the body. That's systolic blood pressure. Diastolic is when the heart is relaxed and blood is coming back into the heart. So top is the systolic, bottom is diastolic. One is contraction phase, other is relaxation phase. So 120/80 is the normal blood pressure reading. 120/80 mmHg, which is the unit of blood pressure, millimeter of mercury, and it's recorded in our older method of blood pressure apparatus. We use the mercury that goes up and down, so it's millimeter of mercury. Each millimeter of mercury that moves up and down, that gives us the recording of the blood pressure. So we have the mild, 120/80 is the normal. So mild is diastolic between 90 to 99 and systolic from 140 to 149. That's mild hypertension. Now moderate diastolic from 100 to 109, systolic 150 to 159 mmHg, millimeter of mercury. And then we have severe, which is more than 110 for diastolic, more than 160 for systolic blood pressure. That's the severe blood pressure. So very important, regular monitoring of blood pressure during the pregnancy on each antenatal visit. And patients who have chronic history of hypertension, it's recommended that they should take regularly their blood pressure even at homes to find out if it's high or not very high, or it's mild. So very, very important, regular blood pressure monitoring during the pregnancy. So that was all about section 1, in which we talked about the classification and degree of hypertension. In classification, we have mainly 3 types. We have gestational hypertension, we have pre-eclampsia, and then we have chronic hypertension. And then degrees, we have mild, moderate, and severe type of hypertension. Thank you for watching sqadia.com.